I'm going to ask Lynne McLennan, Chair of the Western Vic PH Board, to open our conference and an acknowledgement of country. Over to you, Lynne. Thank you.
Thank you very much, and it's been my great pleasure to be the Chair of the Board of the Western Victorian PHN through the last 8 years, which have been a hugely formative and evolutionary period, I think. To commence today, I would like, on behalf of the Primary Health Network, to acknowledge the traditional owners and custodians of the lands and waterways on which we work in this region. The Wadawurrung, Gulajun, Gadabanud, Kirrawurrung, Gunjamara, Jabwurrung, Watchabalak, Jarjarwurrung, Jadawajali, Wergaya, Jardwa and Yubagol peoples. We recognise their diversity, resilience and the ongoing place that Aboriginal and Torres Strait Islanders people hold in our community. We pay respects to elders past, present, and we commit to working together in the spirit of mutual understanding, respect and reconciliation. So it is really very nice to be here today, and we also recognise that some of our delegates remotely are on other First Nations lands, and that today we are this week in National Reconciliation Week, and I was at a very energising meeting yesterday in Ballarat, where I live, with a group forming a campaign to actively get out and campaign for the yes vote as a way of starting to heal what's been referred to as the gaping hole at the heart of our country recently. So this will be, sadly, my last conference to open as board member and a chair for the Primary Health Network, and I feel very confident that when I leave this board in October that it is in excellent hands. I think under the stewardship of our CEO, Rowena Cliff, and her senior leadership team, the Western Vic PHN is not only going to meet the many and varied challenges there are in primary health care, but it's also going to innovate and create better primary care solutions in the future. Now, I've walked up here without the strategic plan. Thanks, Rowena. So, I just want to also commend those board members who are here today. I can see Jane, there's possibly someone else, not sure if Bernard's here, but also acknowledge past board members Tim and Deb and others who may be in the room, because there's a lot of work involved with being on the board of the PHN, and I have to say we've got a really great mix of skills on the board now, and there's just a wholehearted commitment to meeting the very difficult challenges of improving primary care delivery and primary care service connection in this region. My main job here today is to officially present to you our new strategic plan for 2023 to 2025. And this is the bit of a zinger here, conference delegates are the first to see this plan, so that's a big moment, but I'm sure there'll be many more big moments over the next 2 days. So you'll find a copy on this table. It's an excellent piece of work. I think the process is probably getting better every time we do it. It's an excellent piece of work. There's been a lot of consultation during the development of this document, including with our two consultative councils, the Clinical Council and the Community Council, with PHN staff and with internal and external stakeholders, health service partners and community members. So we've also obviously taken into account Victorian and Commonwealth Government policy and recent policy announcements and innovations from those two spheres of government. So this plan's going to provide the sort of guidance. It's going to help us over the next 3 years. So it's really an enabling framework that will help us plan for primary care, the primary care system of the future. So, essentially primary care networks are the primary care equivalent of local hospital networks, but we don't kind of have that same footprint or visibility necessarily. So we work with primary care providers such as general practitioners, allied health, community organisations, funders, to improve primary care services, to integrate services, sounds easy to say, hard to do, and to fund services where there are gaps. We still receive most of our funding, more than 95%, from the Commonwealth Department of Health and Ageing, and as some of you know, this is often tied to specific programs, and often, unfortunately, those specific programs have specific parameters around them. Our annual budget, however, represents less than 1% of the total health spend in Western Victoria. However, we also seek, with our funding, to influence and improve the whole system, even parts of the system that we don't necessarily fund directly, with our aim being to actually provide really good quality, or enable many of you and others to provide really good quality primary care service that actually will reduce the burden of disease in the community generally, and also essentially reduce the number of patients who end up in our often overburdened and very resource-intensive hospital system. So obviously this plan has been deeply informed by the experience of the pandemic, and congratulations everyone here for working through the most astonishing 3 years you could possibly have imagined when you started your career. And I just want to also say that there were a lot of good things that came out of that in terms of relationships that were established during the pandemic in order to respond to the stresses. And I know particularly in Ballarat, where I came from, there were some very strong relationships established between primary care providers and the general hospital system that are now functioning in different ways. So that was quite remarkable. And what's also remarkable is the resilience of the primary care system during this time, the proactive approach of general practices and other primary care providers to the stresses that the pandemic produced. However, now, on the basis that what doesn't kill you makes you stronger, now is the time for us to focus on building a sustainable and a better integrated primary care system that serves our whole community. So this plan really identifies our key strategic objectives for the next 3 years, and also identifies the things that we need to do to enable us to achieve those objectives. And, you know, whenever you're in a forum like this, we always get back to workforce. And workforce, as we know, shortages have become exacerbated significantly during the pandemic. But the other thing we do with these strategic plans, and Rowena is exceptionally efficient at this work, is we do self-check our work to ensure that it's providing people for a benefit for the people of Western Victoria. So we need to see that it's providing better health outcomes for individuals. We need to see that we've got better access to equitable services, and we need to sort of see that our systems are sustainable and that they are supporting a health workforce so that people in the health workforce can focus their energy on people that most need. So our board and our staff are all people of Western Victoria. We live in the communities that we support, and we all want better health for our children and families. So I do encourage you to read our plan, and Rowena and the team would welcome your comments and questions on that, so feel free to nobble them over the next day or so. So I'm really happy to see this year's conference theme, Toddler to Teen Health, which is an investment in the future. And we do know, I'm married to a school teacher, so I know that this intimately. Many people, including children, are finding it difficult to readjust after the pandemic. And we also know that paediatricians and tertiary care specialists are struggling to meet demand for their services. So this conference aims to bolster paediatric skills and knowledge in the primary healthcare workforce. So I think we've got an outstanding program for the 2 days, and I'd like to thank all the speakers, presenters and panel members for making time to prepare for this conference and for being here today to participate in what is an extremely important area of care, our children's health.